It's really rewarding considering all the time and effort I've put into what I do to realize the appreciation, and we all have a common goal and a common will to succeed. Probably Jamie. I think that, you know, she really brings a lot with her talents to OMS 360, and I think she's going to help our practice grow. The collegiality is amazing, that everyone is here to learn from each other, to learn from the presenters, and it's really, really energetic to be in that type of atmosphere. I think that what happened, you know, I'm in the twilight of my career. I'm running for AMOS Vice President, so I'm spending a lot of time out of the office. And OMS 360 really is helping me both within the office, my career practicing, plus also the relationship that I'm meeting with the other practicing oral surgeons. It's really enriching to me both on a personal and a professional level. Probably Dr. Everts and his energy and the way his philosophy and his communication skills. Even though I've been in practice 39 years, I still was able to take away some pointers from him.
What's the hardest thing you let go of when you partnered, and are you glad that you did?
I am a type A micromanager, and I'm still trying to let go of a lot of things, from running to the front desk, doing this, doing that. But once again, where I'm at in my career and how I'm becoming busier and busier with AMOS, it's good to be able to download some of that stuff and put that energy in other directions. Being able to continue to practice how I want, both in the office and in the hospital, because of the support I've had from the OMS 360, has enabled me to take care of a couple of very complicated, medically challenged patients at Children's Hospital. I've had the support to be able to back out of some of the running of my office, both in the front and the back, that I've been able to put more effort into treating these complicated patients in the hospital. I can just concentrate on what I'm doing. I think I'm developing better and better interpersonal relationships with the patients, just spending more time with them instead of worrying about all the nuances of running the practice. I think I'm actually spending more time talking and listening to the patients and learning from them, and actually appreciating the appreciation that they're getting from what we're doing for them. So it's very rewarding. We're not being told what to do with clinical decisions. We're not being told with what supplies or armamentarium to use. We all have the same understanding of how oral surgery is performed, and there's just a feeling of collegiality and independence. I've learned a lot from the non-doctor team at OMS 360. Their dedication, the knowledge of various aspects of running the business of oral surgery. Once again, I've been doing this for 39 years, and I've learned from them all the things I probably was doing incorrectly and not doing to the best that they could have been done. So that's been very rewarding. Well, we did need another doctor, as I am backing out, and they found and helped us get a new associate in a way that we probably would not have been able to do prior to partnering. So that's been quite a relief and quite rewarding. We're all in this together. We're all trying to build something. We're all trying to practice the right way. We're all very ethical, and we all have a common goal. And it feels like one big practice and one big fraternity. There were a couple bumps here and there, as there are with any change or a marriage, or however you want to put it, but as each day and each week and each month progresses, it's been like a load just lifted off of my shoulders, and just being able to practice oral surgery. It's very relaxing and very rewarding. I think that they feel that you're going to be told what to do, how to practice, work more hours, work this, do that, use that, and that's not the case. They're just trying to relieve some of the burden of the running of an oral surgery practice, help you succeed and practice to the best of your ability. We've had some issues with insurance billing, insurance reimbursement, insurance company negotiation, and we've made quite a bit of progress. We're not 100% there yet, but it's really working out a lot better once again than it would be if we would have to fight that battle ourselves. So we've had a lot of support in that, and I can see the light at the end of the tunnel. I just think that everyone really wants us to succeed on an individual level and a collective level. And, you know, we didn't really know that going in. We didn't know what to expect. But I think that's what I would tell them is we all have a common goal. Nothing's going to change ethically how we're practicing, but we're all going to succeed in this together. Just from being here last year to this year is amazing. The energy, the growth, the excitement, the commitment. I have nothing but great things to say about the progress that's being made. I was ready to retire. Now I'm excited to keep working for a little while longer, even though I'm going to be an AMOS officer. I want to continue. Just the biggest reward I can have is a patient saying thank you. And I think that being able to back off some of the pressure of running a practice and just being able to treat the patients is very rewarding for them to appreciate what I do and say thank you for what I do.